Hello, our dear viewers. Welcome to this episode of Health Talk. Today, we handle one of the most critical issues in human health, something they call UTI. And basically, we shall be handling it in women. Why is it so common in women than men? And how can we handle it? What are the signs of this UTI? So, we understand that UTI is any infection of the urinary tract that runs from outside urethra down to any organ that is in the urinary tract. Talk of the kidneys, talk of the bladder, and all that, we term it urinary tract. Urinary tract infection is majorly being caused by one of the gram-negative bacteria called E. coli. So why is it so common in women? We understand the anatomy of a woman, that from the vulva to the anus is so close that any infection can run through from the gastrointestinal system, that is the anus. The feces can go into contact with the vagina, if not so clean, that woman. And we understand, the woman will understand and go into that infection. But secondly, this woman will also maybe undergo, grown-up women will say, let me do something they call maybe family planning. And of course, there are some family planning methods. Talk of the diaphragm and method, talk of the spermaticidal maybe agents that a woman will use. And these things might alter the pH of the vagina, hence predisposing this woman the other side of the infection. We talk about as well this woman maybe coming into the menopause. Menopause is majorly when the estrogen levels lowers, and of course this woman will be susceptible to this E. coli bacteria, and hence that's why older women or grown-up mothers, they are very, very susceptible to this infection here. And other infection, perhaps I might not handle all, but those are the key basics. And we always talk about why is it so common in women that are pregnant. This is also because of the pregnancy that alters some of the hormones this woman has, and then leaving the vagina very susceptible to these bacteria. But we can't run away from douching, which is maybe perhaps also these women might undergo using soap in their vaginal area. And once the normal floras in the vagina are altered with, this person will undergo that systemic bacterial infection in the vagina. Hence, women who always use soap and other stronger agents in the vaginal area, talk of the deodorants, talk of other sprays, maybe to make herself look so nice and to the other partner, but hence all this predisposes us to urinary tract infection. What are these major signs that a woman will have when having UTI? You understand? Most people will come, hey doctor, I feel itching. And of course, that we can't run away from. Secondly, this woman will undergo frequent urination, passing out of urine. That urge will always be there of passing out urine. Another thing, this woman will always have that burning sensation when passing out urine. So the next thing we can talk about is now when things really go to the chronic stage. Someone will start now feeling too much smell. The smell will come into, the discharge will change, of course, and of course other signs that will pop up, you see. So how can we handle this UTI? UTI can be treated. Since we have understood it's a bacterial infection, UTI can be handled by taking antibiotics, by taking key antibiotics, once we have noticed it's majorly bacterial, we can handle it by taking antibiotics. We introduce many drugs in our next episode. We shall introduce you many drugs that you can use for treating this UTI. But we can use drugs like amoxiclav, you can use cefixime, you can use there are many antibiotics that we can use in treatment of the UTI. The next thing, we can use some good extracts that, like a drug in case, we can use urushiol saccate. We have ever tested urushiol saccate and we have proven to be one of the best. That cranberry extract in urushiol saccate makes the bacteria not attached to the linings of the urinary tract, and this drug can give you much good result. As well, being a woman, you understand the lactobacillus in the vagina. Once you take yogurt can give you another good relief. But though it's not a treatment, but it can make the vaginal area one of the best places for the bacteria not to be attached in that place. So, my brothers and sisters, I introduce to you urushiol saccate. Try urushiol saccate in combination with any antibiotics. We believe UTI will be normal. As well, be hydrated, take plenty of water, run away from the soap, the sprays, the deodorants in that area. My dear, the vagina is one of the best places in acidity, and of course the acidity makes any bacteria that runs in contact with the vagina not able to survive. But in case the normal floras in the vagina are altered with, that's where we see most women these days, they have issues with the urinary tract infection. In our next episodes, we shall handle more. I pray you be there with us. Thank you.